So we still on prioritization and we're diving into the rules of prioritization. This will be a good guide as you prioritize your client. And this you must not forget because it's going to save you as you write your NCLEX exam because you will surely meet questions on prioritization. So rule number one, we're going to prioritize the stable. We're going to look out for the stable client and we're going to look out for the unstable client. And we will prioritize the unstable client. Rule number two, we're going to look out for the acute case. We're going to look out for the chronic case. And we will prioritize the acute case. Rule number three, if the case scenario is stating that one client is fresh post-op, so first 12 hours post-op, immediately you see that in a scenario, we're going to prioritize that client fresh post-op before we attend to other medical conditions that other clients are coming with. Prioritize fresh post-op, the first 12 hours. This is an important rule of prioritization. Rule number four, we're going to prioritize the most vital organ. So we'll be diving deep into this so that you would know the order for the vital organs. So I hope we got the rules. We're prioritizing the unstable client first. We're prioritizing the acute client first. We're prioritizing fresh post-op, first 12 hours post-op, and we're prioritizing the most vital organ.